So just wanted to quick talk to you about women have been misled about menopause. The article that went viral in the New York Times. I'm so happy this article came out because we really needed to hear it as a society. Women have been misled about menopause all of these years. This crazy study came out that really changed the entire landscape for women and hormones many, many years ago, and we're still talking about it today. In 1991, the largest ever women's health initiative preventative medicine study came out or started. And then in 2002, the study was halted, and the information that came out to women is that hormones are dangerous, that hormones increase the risk of breast cancer, heart disease, stroke. Unfortunately, this study was flawed. This was a single study that was flawed. But unfortunately, what happened is prescriptions went from millions, 15 million prescriptions were written in 2000. And then by 2002, after this study was released, 2002, yes, that's a lot of years ago. After this study was released, that number plummeted to just thousands of prescriptions were written. I've been saying for many, many, many years, decades now, that women should not stop taking hormones. Hormones, if they're taken in the right amount and the right type of hormone, staying away from the hormone that was talked about and discovered in the Women's Health Initiative study. Stay away from that hormone. Use hormones in the right amount and the right types to reduce your risk of osteoporosis. Keep your bones and your muscles strong as you age. Reduce your risk of colon cancer. I mean, we always talk about doing a colonoscopy. Well, that's important because it will detect colon cancer way before you have symptoms, but what about preventing it? What about reducing your risk of colon cancer by 30% if you take hormone replacement therapy as a woman? Why would you not consider this? What about reducing your risk of heart disease, the #1 by far killer of women over the age of 50? What about reducing your risk of dementia, cognitive decline? What about just helping you feel better, more alive, more awake, more alert, sleeping better, better mood, less depression? How about less diabetes? How about reducing your risk of gaining weight as you age if you take hormone replacement therapy? It helps stabilize blood sugar, lower insulin levels. These are things that women need to know about hormone replacement therapy. Why go to somebody who's going to tell you you don't need it? How about having more tolerance for the suffering of women today? How about having more tolerance for the symptoms that women suffer from day after day after day with hormone decline? Don't put it off. See somebody that will listen to you. See somebody that will assess you, that will test your levels, that will balance you according to what you need. How about getting the facts about what happens if you don't take hormone replacement therapy? What happens to your body as you age if you decide to not replace any hormones to any biological age? It's time to get more information, and I love this article that came out in the New York Times. I love that so many millions of people have read this article because it's about time. So don't wait, don't put it off. Do not have one more night of not sleeping well and waking up feeling foggy. Get your hormones balanced, live longer, live better, live with less age-related illnesses.